How do you locate competent mental health services for the treatment and diagnosis of the situation in your family? The difficulty you're going to be facing is that you will find no competent mental health services in the family courts for a variety of reasons. And so we're going to have to cobble together or put together the necessary competence to get you the treatment that you need. And ultimately, this lands on treatment. We need to fix things for your family and fix things for the child. I don't care what the problem is, we need to fix the problem. And for that, we're going to need treatment. And that we need competent treatment. You're going to be looking for mental health competence, which is going to be the challenge. So let's talk about how you do that today. Locating competent mental health services. You're going to have a choice here. We can either recruit competence in from outside the family courts, or we can reform the mental health people that are in the family, currently in the family courts, which is questionable. So here's the situation that you're looking at. You have a problem and you need to fix your problem. And so you're going to need a treatment plan to fix your problem. To get a treatment plan, you will need a diagnosis because diagnosis guides treatment. The treatment for cancer is different than the treatment for diabetes. So it's very simple. You got a problem, you need to fix the problem. We need a diagnosis to fix the problem. So we're going to need a mental health professional to conduct the treatment ultimately. And to get the diagnosis that will guide the treatment plan. If we wind up um, uh, treating cancer with insulin, the patient is going to die from the misdiagnosed cancer. So the critical issue is you are going to need an accurate diagnosis. But that's just not the end point. You just don't need an accurate diagnosis. You need the treatment plan based on that diagnosis. Now, with severe attachment pathology, a child rejecting a parent, the differential diagnosis is child abuse for that. So we're going to need a mental health professional who is capable, competent, willing, motivated to conduct a proper risk assessment for the child abuse that's potentially involved. The difficulty is finding that mental health professional for you in the family courts. Let's discuss how do you locate a competent mental health professional for two different roles. First, the diagnostic assessment role, in which we, look at the two differential diagnoses. Which parent is potentially abusing the child in this case? The targeted parent, in which case identify what the child abuse is, and we'll put it on a treatment plan and fix it. Or the allied parent, creating a shared persecutory delusion and fictitious attachment pathology, psychological child abuse. Then we put it on a treatment plan and we fix that. But those are two different treatment plans based on our diagnosis. So we need the diagnostic assessment. And ultimately, though, we need a treatment as person. So one of the things when you're looking for the mental health professional who's going to work with this situation and help solve this situation for you, if you're going to finally get a good person, get them for the treatment. And don't get them just for the diagnostic assessment, because then you're going to switch them out and get somebody else for the treatment. It's like, if we got somebody good, then let's get them for the treatment. And treatment depends on diagnosis, so they can do the diagnosis as the entry point into their treatment. And so that's a more efficient approach to utilizing the limited mental health resources, in fact, non-existent mental health resources currently in the family courts. So the question that you will be looking at is whether or not to recruit mental health competence from outside, or reform the forensic psychologists who are currently in the family courts. There are and it's just important to understand, there are no competent mental health services currently in the family courts. The forensic psychologists are the worst imaginable. They are ignorant, lazy, incompetent, and unethical. And forensic psychology owns you. So that's, you've been given over to this specialty practice that you're being forced to use their forensic custody evaluations that are awful, cost a lot of money, don't diagnose anything. They are ignorant, they are lazy, and they are unethical, and they're incompetent, and they don't care. So the idea of starting with that and then trying to reform that, you're not starting with a professional caliber human for the forensic psychologist. And the problem is, for the last 40 years, you've been given to this experimental new approach, and clinical psychology left. Everybody's abandoned you, so that the clinical psychologists who are competent work everywhere else but in the family courts, and because it's too dangerous to their license. And so after 40 years of forensic psychology completely dominating and having control of everything, there are no clinical psychologists who are competent with the pathology in the family courts. So you can find a clinical psychologist who's competent with personality disorders, but not with how they affect children and the families, and not with attachment, and not with delusional thought disorders and child and family systems. You can find clinical psychologists who's competent in family systems, but not in delusional thought disorders, not in custody conflict, not in factitious disorder. And so you can find the pockets of clinical expertise, but none of them have been working in the family courts for 40 years. So it's been sterilized. The family courts have been sterilized of professional level knowledge. Only forensic psychologists are here, and it's just dropped to the bottom. They're unethical, incompetent. The question becomes, where are the licensing boards? Why aren't the licensing boards enforcing standards of ethical practice and competence? And the moment licensing boards would enforce that, everything would be solved. The problem is the licensing boards are being controlled at this point, or influenced by the forensic psychologists. And so they're allowed to self-review, and they don't hold themselves to standards, and they've exempted themselves from competence standards as a way of protecting themselves, and that's what's dropped everything to the bottom over here. So it's a system-wide problem having to do with oversight and review and decisions about creating a new specialty practice, and we're going to give this experimental approach. So that's a broader systems level. The difficulty is, you've got a child currently in the family courts who needs fixing. Your family needs fixing, and there is no competent mental health services in the family courts. You got the choice: forensic psychologists or nothing. And they're awful. So what do? You're going to have to either locate people from the outside and bring them back, or you're going to have to take these incompetent ones and make them competent. Okay, so basically that's your situation. So those are your two options. We can recruit competence. So you look to clinical psychology to find closely related competence. Dialectic behavior therapy is what I recommend the fathers look for, because you're most likely in the borderline mom pattern, and the dialectic behavior therapist would recognize a lot of the borderline pathology that's going on. Intimate partner violence I recommend for the targeted moms, because you're more likely in the narcissistic dad pattern, has a higher spousal abuse pattern feel to it. And so the intimate partner violence, the domestic violence professionals will more fully recognize the narcissistic dad pattern and the spousal abuse pattern that's involved. And both of those are trauma-related or personality-related psychology people. And so they've gone into domains that require a certain amount of toughness to work with personality disorders, narcissistic, domestic violence, spousal abuse, or borderline personalities and suicidality and all that sort of thing. So your dialectic behavior therapists and domestic violence people are most likely to have the backbone, the professional backbone necessary to make the child abuse diagnosis. And that's what we need in this. We need the child abuse diagnosis. That's the accurate diagnosis, is child abuse. So now with the, if you're going to take that approach and locate competence and recruit into the family courts into your situation, what I can do is I can scaffold their deficit knowledge. So whatever they don't know, you pair them with me and I can help scaffold that. The second option is to locate a forensic psychologist currently working in the family courts, so they will be more familiar with the family courts. The clinical people won't want to come work in the family courts, so they'll tell you no just because, and they shouldn't, because they're not competent and they don't want to work in the family courts, and they just don't do it. So so you may be only left with forensic psychologists because that's the nature of the broken system right now. So you might be left with trying to reform a forensic psychologist. So what you want to do there is look for a forensic psychologist who's willing to sort of switch over to clinical psychology, stop being a forensic psychology and become a court-involved clinical psychologist. The advantage to that is that they have knowledge of the family court system, so they're really comfortable with working with the pathology. They just don't know the pathology they're working with. The disadvantage is they are unethical, they are ignorant of sin, they are lazy, they are unmotivated, they are just the worst kind of professional possible. And oh my goodness, that's your starting material. So again, though, if you pair them with me, Dr. Childress can scaffold any deficit knowledge they have. So that's the sort of the core to understanding the solution for you is you can pair me with whatever mental health professional you have in your location, and we can elevate their knowledge and their competence level and everything. Excuse me. And that's why we do second opinions and do this consultation sort of stuff. It elevates the standards of practice out there. So we're kind of, for you, you're trying to fly the airplane as the airplane is being built. The difficulty is there's no competent mental health services in the family courts. The systems need to get focused on that. Why is the American Psychological Association not providing the courts with competent mental health services? Where are the licensing boards? If the licensing board started to enforce ethical standards for competence, then boom, you'd have competence right away. Why aren't the licensing boards enforcing ethical standards of practice? Figure that one out. Legislatures need to start looking at that. Why aren't licensing boards enforcing standards of practice? So now scaffolding the knowledge, Dr. Childress consultation to mental health professionals. So this is a dense little slide here. It's 2.01 boundaries of competence. And I want to go through this for parents to understand what's involved relative to the mental health people you're working with and what their obligations are. Okay. So first off, it says psychologists provide services, teach, and conduct research with populations and in areas only within the boundaries of their competence based on their education, training, and supervised experience, consultation, study, or professional experience. So it defines that we're only allowed to do a limited kind of stuff where we're competent. We're not allowed to go out and start being incompetent. We're not allowed to be incompetent based on our education, training, and experience. So that's looking at their vita. And none of them have the education, training, and experience in delusional thought disorders or attachment pathology or in factitious disorders or in family systems. So they are all practicing beyond the boundaries of their competence in some domain. So they should be taking steps about that. And standard 2.01 C and D talk about the steps that your mental health professionals should be taking because they're not competent. The psychologist planning to provide services, teach, or conduct research involving populations, areas, and that would be delusional thought disorders, factitious disorders, maybe family systems, attachment pathology, severe attack. So those are the areas. They have to be competent in all of them, or else they're not competent. And so they're practicing, they're providing services in areas, techniques, and technologies new to them. Yeah, delusional thought disorders, factitious disorders, that undertake relevant education, training, supervised experience, or consultation or study. So consultation is the method for them to improve and meet those competence requirements. So it's their obligation to seek competence, not for you to ask them to become. No, it's the motivation. It should be coming from them, not you. D is also relevant and this is relevant. D is relevant for the forensic psychologist. Okay, if you're trying to reform a forensic psychologist, is when psychologists are asked to provide services to individuals for whom appropriate mental health services are not available, and that's the current situation in the family courts. If they don't conduct this assessment and do the treatment, there's nobody else. You've looked. There's nobody else who works in the family courts but this limited group of people. And if they don't do it, you're not going to have anybody. So the mental health appropriate mental health services are not available, and for which psychologists have not obtained the competence necessary. That's the piece that your reformed forensic person has to integrate and understand. If you're going to pair them with Dr. Childress to do your assessment, they're going to have to understand that they're not competent. And that's why they're getting paired with Dr. Childress. Now, notice it says supervised experience. Yeah. Okay. I might suggest supervised, but you know what? That's a telehealth consultation. Okay. You put me in the assessment in telehealth. I'm sitting in the office in the computer. We write a 2-person report. We have third consultant from the other party. That's fine. We got 3 reports going into the family courts. We can put it together. Okay. So that's fine. But if they're going to be a forensic psychologist, or they're going to do this, switch from forensic psychology to court-involved clinical psychology, shift their role into doing a diagnostic assessment, they have to understand the limits of their knowledge relative to delusional thought disorders, relative to the attachment system and attachment pathology, relative to family systems, relative to factitious disorders, and maybe even personality disorders. So I don't need an arrogant, ignorant, unethical, incompetent mental health person conducting the assessment and me in second opinion. That's just going to create problems. I'm willing to do it if that's who you're going to pair me with. If that's the best you can find out there, then that's all we got. Okay, but that's the situation. So psychologists have not obtained the competence necessary. Psychologists with closely related prior training or experience, that would be your forensic people or your DBT people or your IPV people. So you find somebody with closely related experience or prior training may provide such services in order to ensure that services are not denied if they make a reasonable effort to obtain the competence required by using relevant research, training, consultation, or study. Okay, so understand this. 2 things to understand on this. 1, the motivation should be coming from them, from the psychologist to be competent. The decision before the court is immense. The child's life hangs in the balance of the court's decision. We have possible child abuse by one parent or the other. If we make a wrong decision, if the court makes a wrong decision, that's going to destroy that child's life. We need an accurate diagnosis of the possible child abuse in this family that the court can rely on for its decision making. There could not be a more momentous role for professional psychology than returning this diagnosis and conducting this assessment. The mental health people who are involved in that need to understand that. They need to understand how important and vital and central their diagnostic assessment is. And they need to be able to get it right 100% of the time. And that means they should probably be consulting 100% of the time. 100% consulting all the time, because it's going to improve the quality of their decision making. And we should always be improving the quality of our decision making when it's going to the court. So the motivation should be coming from them. I should not have to educate them. They should already know. And no patient should ever have to explain the pathology to the doctor. If you are explaining the pathology to the doctor, that doctor is incompetent by display of their ignorance. So no patient should ever have to, but you're having to explain the pathology to the doctors. That's the low state of forensic practice in the family courts, is you're explaining, the patients are explaining the pathology to the doctors. That's how bad the doctors are. Incredibly bad. And the question becomes, where are the licensing boards? Nowhere to be seen. So you're having to deal with incompetent mental health. Where's the APA over here? Why has the APA allowed these doctors to conduct this experiment of forensic custody evaluations on you that don't diagnose, don't treat, don't fix anything? Where's the alternative? Where's the clinical treatment? Where's the diagnosis people? Where's the APA providing the courts with mental health people who are competent? Nowhere to be seen. We need to clean sweep a lot of this systemic failure. And we need, by starting with recognizing there has been a systemic failure. And so the powers that be need to focus over here and fix the problem in their systems, in their neglect. For 40 years of the family courts has resulted in the destructions of tens of thousands of lives. So over decades, of a failed experiment. So it needs sort of a reorientation and correction. In the meantime, you've got a family. In the family courts, you've got a child that's potentially being abused that we need to get treated and fixed. And so what do we do about your situation? So what it's called building capacity. I am only one human. The problem is system-wide. All 50 states, internationally as well, but we'll focus on the United States. It's in all 50 states. You've been given over to forensic psychology and neglected for 40 years. So it's a system-wide failure. Yes, I could do it all, but that's not the solution. It's not Dr. Childress solving everything because I'm the lone competent mental health person in the family courts. It's to build capacity. That's where we're located right now. That would be the pilot program for the family courts, would be designed to build capacity. And second opinion consultation and the telehealth consultation is designed to build capacity. So what I'm doing is scaffolding the local area mental health professionals in the diagnostic assessment of court-involved attachment pathology, and that will build capacity in the local area mental health system. So once I'm brought into a matter, you pair me up with your local mental health professional, the best you can locate. You pair me up with them, and I'll elevate their standards of practice, hopefully, and at least mine will be up there, and hopefully they'll match that. Depends on who you pair me with, but and so we can get an accurate diagnosis returned to the court for its decision making. In doing that, I write off Pale Rider Clint Eastwood. I've cleansed the town bad guys and ridden off into the sunset. But that leaves you with a mental health professional in your local area community who's now done the assessment, worked with Dr. Childress, consulted, and now and that person can then serve as a resource for the other mental health professionals in the region. And so rather than me going around like a little whack-a-mole, pair me with a mental health professional in your region. Let's improve the quality of mental health services in your region, in your location. Now, I would prefer you pair me with a competent mental health professional, get as close as you want. So that would be the dialectic behavior therapist who's willing to work, come back in the family courts and help out in this situation, or the intimate partner domestic violence professional who's willing to come into the family courts and help out in this situation, the spousal abuse side of the situation. And so I prefer a clinical psychologist that you recruit back, pair me with them, and then we can get you an accurate diagnosis and use that same professional for treatment. Okay, so they're coming, you're being brought in for treatment. We need an accurate diagnosis, one way or the other. If the targeted parent's abusing the child, I need an accurate diagnosis on that, then because that's what we're going to fix. Or if it's this one, it's well, one way or the other, we need an accurate diagnosis on this situation. So, my preference would be a competent person. If you pair me with a forensic psychologist, see if you can locate a new entry one, who hasn't been in the field very long, because they're motivated still they're looking to get into the family courts. And the only option to get into the family courts right now is forensic custody evaluation. So they kind of get into that, but maybe hopefully they're recognizing that's a dead end road. It's not a good path. And Dr. Childress has a better approach on these things. And they're willing to move over to the Dr. Childress and clinical psychology approach to the family courts, in which case you pair them with Dr. Childress. They may like doing that and getting some experience working with Dr. Childress and how I would approach the clinical diagnostic assessment things. And so you locate the person early forensic person who's willing to switch. They're familiar with the family courts. They feel comfortable. That's another option. Pair me with an old forensic psychologist. We may have some interesting discussions, but unless they jump over, and if they're really willing, I need the motivation. Fundamentally, this is a child abuse diagnosis that we're worried about. There's 4 types of child abuse: physical, sexual, neglect, psychological. They are all equally severe in the damage they do. They differ only in the type of damage. Psychological child abuse destroys the child from the inside out. So we're worried about child abuse in this situation by the targeted parent, by the allied parent. We need a serious mental health professional coming in here to get an accurate diagnosis, because the court's decision is going to be based on our diagnosis. So I need the motivation from them to provide the highest caliber of professional services to the court. When I'm involved in a matter, I have 2 clients. As a child and family therapist, my client is always a child. Okay, so I'm coming into a situation, my client is the child. And when the court's involved, I have a second client. That's the court, because the court has a decision to make about the child. And so I have an obligation to get the court an accurate diagnosis and an effective approach to treatment that will resolve the family situation so that the court can make its decisions. So you pair me with a mental health professional that is motivated to do that, and we can get the court an accurate diagnosis. So to involve me in a situation, if you're interested in involving Dr. Childress, what that involves is a scope of service agreement with me. So that means the attorney, the parent client, and Dr. Childress meet in my online office here, DoxyMe, Dr. Childress, to discuss a scope of service agreement regarding the services rendered and the payment received. So, that may be review of documents, that may be involved in this online assessments, or whatever, the situation is. You get your attorney. I have to work through an attorney. I can't work with pro se parents. So, to keep me safe, forensic psychology doesn't like me, and they control the licensing board. So it's a dangerous world for anybody who tries to help you. Okay, that's what the pathology does, is it drives anybody who tries to help you away. That's why clinical psychologists work with you, and then it gives you the worst imaginable forensic people. That's by design, to isolate you from rescue. So I'm over here because this is my pathology, and I'm helping you build capacity in your mental health resources and services to be able to address the pathology that's involved. Persecutory delusions, factitious disorders, attachment pathology, and family systems pathology. Complex interweave of pathologies, but its pattern, it's always the same. It's the same 40 years ago, it's the same 40 years from now. It's not an evolving thing. Once you learn what it is what it is. So the first thing would be to get me involved. And you can set up a meeting, scheduling through my online website. The second part is to pair me with somebody close. It's up to you. Get me who you're going to pair me with. And okay, so when seeking a second opinion telehealth consultation on active assessment by a local mental health professional, find as close as possible. That could be a forensic person you're reforming. That could be a clinical person you're recruiting. Get them. I have a mental health consultation page on my consultation website. That's for them. You can give that to them. If they seem like they're motivated, if they seem like they get it, if they seem like they're cooperative, then that's probably maybe a good person to pair me with. And if you're going to locate somebody for the diagnostic assessment, you don't switch them out for treatment. Locate them for treatment. And then as part of that, we will get the diagnosis and a diagnostic assessment. And if this is what your approach is, to pair me up with somebody in the local area to do a diagnostic assessment and me and telehealth second opinion, please talk to me ahead of time just to let me know that, it can be an email. It doesn't need to be consultation. Just say, we're seeking, and your attorney can send that to me. Your attorney just says, we're seeking a court order for your involvement in this matter. Maybe say, would you be available? And I'll say yes. I will always strive to cooperate with court orders. So if all of a sudden somebody says, oh, we got a court order for you to do the XYZ, I will always try to cooperate with court orders. But I've got things going on. And so please alert me in advance of your intent to bring me on like this to establish the intended scope of service on this. But you don't need to do it early. That's why I'm kind of talking to you now. Really, when you need to start connecting to me is when you have the connection point for me. Okay. And the connection point for me is the mental health person you're going to pair me with on the assessment and the court order that's going to make all that possible. Okay. So you have a little setting up to do with your attorney, on a little bit on the court order and a little bit on your mental health. And as you get that put together, you got me over here. And so you just reach out to me and say, hey, and I say, yeah, okay. And you put it together. Okay. I'm in a very limited role of providing second opinion consultation. You're putting together your treatment team. I'm in a role within that treatment team. So, it's up to you at this point, putting together your treatment team. On your treatment team is your attorney, the treatment provider. Dr. Childress is your consultant, whether it's an active consultant or you're just using my website and my videos and stuff. I'm on your treatment team as a consultant. You may have other people, coaches on your treatment team. Personal support, your family members or a therapist would be on your treatment team. So with that, we're cobbling together the plane, building the plane while we're flying it. Where the issue, at the moment the licensing boards would start to enforce competence, then the family courts would get competence immediately. The problem is the forensic psychologists on the licensing boards. If the licensing boards start to enforce competence, then that's all the forensic psychologists would be sanctionable, and they have to leave the family courts because they're not competent. And none of them in attachment pathology, delusional thought disorders, factitious disorders, and everything. and so you're not going to have anybody here. That's their whole career. The moment we switch to clinical diagnostic assessments, forensic custody evaluations disappear. That's their whole career. That's the only thing they do. So, and they're on the licensing board, so they're not going to require competence because that's their career. It's a massive conflict of interest. That's the New York Blue Ribbon Commission on Forensic Custody Evaluations. We need to sweep them out. We need to get focus back over here from upper levels professionals to develop the capacity and provide the courts with high quality mental health services. So with that, I'm going to head off to my Sunday coffee here and talk with you next week about some aspect of the family court pathology and fixing things over here. So with that, take care.